faced with an existential moment that caught everybody by surprise, as His Highness said earlier. But despite the gravity of it and the loss and the human cost, almost 5,000 people lost their lives in Liberia as a result. It is also important to note it was an important moment that called attention to the weaknesses and vulnerabilities of the health system in Liberia. Today, Liberia is in a much stronger place when it comes to public health, when it comes to health institutions, compared to the period before Ebola, even if before Ebola the country was economically growing, but the health system was very fragile. How is the UN helping? In many ways, and I will not a very long list of support and partnerships, but I think the fact that as a result of the Ebola crisis, the fact that you now have the World Health Organization physically present, working with the health departments in all 15 counties, which was not the case before Ebola, is a step in the right direction. UNDP, we were at Redemption Hospital yesterday, and it was quite clear how Redemption Hospital was at the center of responding to the crisis back in 2013-14, and how today that support that came through not only UNDP but also all the other UN agencies and partners, the health system is in a better place. There is a Tocton program which, because of Ebola again, facilitated the return of qualified Liberian nationals, including medical personnel, some of who are still in the country. In fact, they came to join the national effort to respond and never went back to where they were, either in Europe or in the United States or elsewhere. They are still here. Some of them you see in Monrovia, some of them you see in Lofa, for example. Dr. Kamara, who is the senior medical doctor at Lofa Referral Hospital, was a practitioner in London, but because of Ebola, he chose to come back, and he's still in Guantanamo. UNFPA, another health UN actor, is actually, as we speak, bringing qualified Liberian doctors and pediatricians, not for Monrovia, but to actually be deployed in the counties where the health conditions, especially of women and children, continues to be a big challenge. And in that context, together with WHO, waiting homes are being built next to hospitals so that the pregnant woman who comes from a very far away place, by the time she reaches the hospital to get the care for delivery, sometimes it's too late because of the length of the journey and the difficulty of the journey, especially during the rainy season. So these homes are situated next to the hospitals so that at the last stage, a pregnant woman can be accommodated there, goes safely through the delivery, and then safely returns home. But the UN is not the answer to all the questions. In fact, you are the answer. And that starts with a number of legislative actions that the Parliament needs to take to make the health system a better one, including decentralization. The Local Government Act is stuck in Parliament for the last 2.5 years. And that will lead to decentralization, including in health and public health management, because everything remains to be highly centralized, and that is not good.